Hi, my name is Geraldine Bates. Today I will be discussing fundamental principles of care coordination. Care coordination involves a planned, structured approach to bringing together medical services and meeting the demands of the patients in order to produce top quality health outcomes. It calls for proper resource management, information, and care related activities across different healthcare providers and settings. The basic principles that care coordination are built upon include patient-centered care, communication, teamwork, and treating patients in a holistic manner. According to Karam ETAL 2021, the objectives of these rules include efficient and quality care, as well as responsiveness to the patient, thereby reducing the possibilities of mistakes, duplication, and gaps in care. Proper care coordination increases patient satisfaction, contributes to improved health outcomes, and leads to the efficiency of healthcare delivery. This paper looks at the key principles of care coordination and emphasizes the crucial role that nurses perform alongside the care coordination process, consequently empowering them with the necessary information to take part actively in the process and ultimately improve the health care outcomes for our community care center. Partnership with patients and their families, taking into consideration the desire for the treatment outcomes, and at the same time respecting their preferences, values, and needs is the basics for achieving the desired results. The drug-specific educational interventions are a critical strategy in the process of collaboration. Though ensuring the availability of personalized materials about medications, such as their purpose, dosage, side effects, and interaction with other drugs. Nurses help patients and their families be an active part of their health management. According to McIntosh ETAL 2020, the training must be made accessible and offered with respect of cultural competency, having accounted for language capacity, literacy levels, and ethnic origins of the patient. As a result, patients who have an adequate knowledge about their medications get better adherence and keep their health in a better shape and are not readmitted to the hospitals as frequently. Another crucial element of an effective collaboration is culture competency strategies. Such approaches include knowledge and appreciation of culture distinctions, preferences, and values which shape the ways people take care of themselves and understand health. Nurses should aim at creating a healthcare atmosphere which is culturally sensitive and respects diversity. Studies indicate that culturally competent healthcare can lead to a higher patient satisfaction, better rapport and communication between patients and healthcare providers, and better health outcomes. According to Brooks ETAL 2019, these strategies can be incorporated into care coordination by nurses to improve the manner in which they work collaboratively with patients or with families and patients, which will create a situation where decisions are jointly made and shared and the patients feel appreciated and heard. Change management in healthcare is a direct factor on the patient's experience, which emphasizes the need for strategies that prioritize patient-centered care. Components of communication facilities, environment of care, and patients' involvement in decision-making play an important role. Implementing changes in these domains requires a carefully planned, clear communication, feedback mechanisms to make sure that the changes lead to improving quality of patient care. According to McIntosh ETAL 2020, having patients and their relatives taking part in the change initiatives results in better and longer lasting changes. For example, redesigning the care delivery process with the help of patient feedback can ultimately increase the relevance and quality of care services, resulting in higher patient satisfaction and improved outcomes. Furthermore, managing the change requires to deal with the resistance that may come from patients and the healthcare providers. Strategies like continuous education, open communication, and showing how beneficial change is are some of the measures that can be taken to reduce resistance and create a culture of continuous improvement. According to McIntosh et al. 2020, the collaborative, inclusive, and patient-centered change management strategies play a vital role in significantly improving the overall patient experience. Through the targeting of these factors of change management, nurses will directly influence the quality of service and patient satisfaction by ensuring that patient-centeredness is maintained throughout the care delivery. Integrated care plans are vital to ensure that the patient care is comprehensive, consistent, and of high ethical standard. These plans are underpinned by the ethical principle of beneficence, which requires health providers to act in patients' best interests, and autonomy, which entails respecting the patient's rights to make informed decisions. The ethical framework of care coordination considers the possible consequences of care decisions on patient health and well-being, according to Walton et al. 2022. It requires both consideration of the clinical requirements of the patient and their personal values in parallel with the limited resources. The ethical approach to care shares the values of transparency, informed consent, and involvement of patients and families during the decision-making phase. The ramifications of an ethical rule-guided integrated care plan are very broad. It implies that the treatment is not only clinically appropriate, but also morally right, observing the dignity and rights of the patients. The patient autonomy, patient-centered care, and non-maleficence principle could become the main target for setting care provision standards. According to Walton et al. 2022, this ethical course of conduct assists to design a treatment program that should meet not only the medical needs of the patient, but should also consider their choices and circumstances. This approach leads to the improvement in patient satisfaction, better adherence to care plans, and increased health outcomes, as it has been proved by the literature available. The health policies determine the nature of healthcare settings in which care coordination takes place and has a significant impact on results and patient experiences. Special policy stipulations such as the promotion of the integration of services, access to care, and patient rights directly affect the successfulness of the coordination of care. According to Savold et al. 2021, the implementation of the policy that promotes a smooth flow of the healthcare patient information among the providers is a key determinant in coordinating the care, elimination of redundancies, and the quality of time and interventions provided by the providers. The implementation of such policy provision is the enhancement of the care delivery process in terms of quality and efficiency, with the goal of attaining good health results as well as enhanced patient experiences. Positive effects of healthcare policy on patients' outcomes are seen in case studies which confirm the fact that policies that support electronic health records usage and health information enhance exchanges lead to the better coordination of care, reduce medication errors, and enhance the access to care for patients. According to Savold et al. 2021, moreover, policies that promote continuous coverage not only remove barriers to obtaining basic services, but also contribute to health equity and good results. Through knowing the effects of healthcare proposals, nurses can advocate for the policies that uphold the delivery of effective care coordination, as well as develop such practices that are proof-based and patient-oriented. In summary, the components of care coordination span a range of strategies, ethical issues, and policy considerations, playing an important role in improving the quality and effectiveness of patient care. Through the cooperation with patients, family members, and the understanding of change management, applying ethical principles in caregiving, and the recognition of health policy effects on patients, nurses become powerful agents in the process of care coordination. These principles and practices can help nurses expand their knowledge on how to best care for their patients. The nurses working as care coordinators are motivated to become role models, promoting patient-oriented care, and driving significant improvements in the management of health care services on site as well as within the community at large. Thank you.